Hello and welcome to WYCC.org for In the Loop, the After Show. Joining us today are William Natale, Executive Director for the Illinois Center for Broadcasting, Lissa Druss-Christman, consultant with Seraphin and Associates, and Ivy Walker, CEO of Helios Digital Learning. Hello again, everybody.
Hi.
So the deadline is approaching for people to sign up for the Affordable Health Care Act, and now we're seeing a barrage of advertising and info commercials and The Onion, and it looks like just this last dash marketing. And Lissa, is this too little too late?
It's interesting because this is a government program, but the government is treating it like a private business. And they are putting all the stops. They're doing a full court PR campaign. They bought a half-hour show of WGN's Morning News a week or two ago, which was unprecedented. They're taking out, having The Onion write about it. I believe a couple other TV personalities are coming out and giving campaign speeches about it. It might be a little too late because they are really going for the gusto. They're going for the big names and the highly rated programs to get attention to it because not enough people are signing up.
And Ivy, they're clearly aiming for young people.
Absolutely, and to the point that they're using The Onion and the Between Two Ferns in order to get the message out. If you want to get the young invincibles to sign up, you got to go where they are, and that's where they are. And frankly, the system, the healthcare system will not work. The new form of insurance will not work if you don't have the risk appropriately spread across the different age demographics, and the young invincibles are not signing up in the numbers they need them to.
Right. We need about 40% of those to make the program work. Right now, 25% have signed up. When you do the math, Illinois spent about $33 million on this campaign. According to their numbers, 114,000 people signed up so far. So that's about $290 per enrollee. William, is that money well spent?
That's not a good CPM, as they would say in the advertising world. But one can question whether it's money well worth spent. I think obviously the officials in D.C. would say it is. I think once you get this program started, and once you get the young people on board, then the program is sustainable. It is not without young people on board.
But where do young people get their information? From social media, from the internet. And it appears that they are doing their own research and looking and learning that this may not be the best thing for them. And a lot of them are still under their parents' health care coverage until they're 25, 26 years old. So are they making their own decision from being informed and being informed from the other side as well, the positives and negatives of this effect?
Another major health issue coming up this fall here in Chicago. Chicago Public Schools has announced that 24 high schools will begin giving away condoms to high school age students. Is this the right thing to do, Ivy?
I have a high school age daughter, and I will tell you that I would prefer that she not be getting condoms from her school. That said, the reality is that young people are having sex at about a rate of 35%, and they're not using protection. And so they need to feel that there's some place where they can go to get the information and the resources they need to be safe. Young people are the only group of individuals who are still seeing an increase in the transmission of HIV, and that's a real problem.
Why is this the job of the schools and not the parents?
You got to look at something. The Rahm Emanuel administration, Alderman LaTosha Thomas, they're not going to do something like this without putting the research and the thought and just do something at random. There's been a lot of research done on this, obviously, by City Council, and they believe strongly in it, or else Mayor Emanuel would not take this public risk, this public PR risk.
Yeah, Mayor Emanuel did make a point of stating that the responsibility is still very much with the parents, even with this program. But the reality is, as Ivy pointed out, it's a fact. I mean, we have to deal with this in some way. Maybe the smart thing is to, dispense with the condoms.
The numbers are a little startling to see that Chicago's teen pregnancy rate is higher than even in New York. But where should this information come from, and whose responsibility should it be to provide both information and birth control to teenagers?
It starts at home. It starts with parents. But after that, kids spend a lot of time in schools. So are the schools failing to educate the children in the risks, the high school children, in the risks of premarital sex and the possibility of getting pregnant, and what do you do to prevent it?
It takes a village to raise a child.
I've heard that before. Hillary Clinton, I believe.
Absolutely, absolutely. And so I, as a parent of a teenager, have a responsibility to educate her on these kinds of issues. But at the same time, she has influence from television, from her friends, and she's out in the world. And so if my message is not getting through to her, then yeah, I think there ought to be some other avenues that she can turn to get the information that she
But
needs.
as a parent, should you be able to opt out and say, look, I don't want my child to have this service from the high school?
You know, I think parents we spend a lot of time in the dark, and I think we like to think things about our children that aren't necessarily true. And I think, you know, putting that opt-in out for condoms, I think that creates a gap in the system. You know, those are probably going to be the very kids who need that information. You know, you can't keep them in the dark.
But one thing is prevalent. How early do you start talking to your children about birth control? It's obviously a lot earlier than
Well,
it used to
certainly
be.
by high school, right? It should be
I
by
have an
high
8-year-old
school.
daughter. I'm not saying I'm going to talk to her about it now, but at what point do I start talking to her about it?
William, why don't you jump in here?
Well, how many parents really, you know, grab their son and put the arm around the son and say, hey, you know, here's some condoms. I mean, that doesn't really happen. Possibly on a female side, maybe it does in terms of mom with birth control with their daughters. But I still think that that's a touchy subject for most parents.
Well,
You know?
it's touchy, and the kids don't want to have that conversation with you.
And on
They
that
don't
note,
wanna
we
talk about
are
it.
running out of time, folks, so we have to wrap it up. William Natali, Lissa Christman, and Ivy Walker, thank you very much. Until next time, goodbye.
Goodbye.